Dr. Chin, many spine surgeons see patients who do great for 5 years, but then develop unexplained osteolysis or implant loosening. Why is this still happening in modern TDR?
It's a frustration we've all felt. We've historically blamed technique or patient selection, but the data points to a silent enemy, the dust. Most articulating discs rely on a ball and socket mechanism. That friction creates submicron debris, particles so tiny they are invisible to us but highly hostile to the body's immune system. Essentially, we've been implanting devices that, by their very design, eventually trigger the body to attack its own bone.
You mentioned submicron debris. Why is the size of the wear particle so critical to the success of the surgery?
It comes down to biology. Your immune system has a cleanup crew called macrophages. When a particle is smaller than 1 micron, submicron, the macrophage eats it, but it can't digest it. The cell dies, releases inflammatory cytokines like TNF-alpha, and triggers a feedback loop that dissolves bone. This is the Achilles heel of articulating discs. To solve it, we had to stop the rubbing entirely. That's why we engineered the AxioMed disc to move via internal deformation. It deforms, it doesn't rub.
You recently published a study in the Journal of Bone and Joint Surgery that put this theory to the test. How extreme was that testing?
We pushed it further than anyone else. We put the Freedom lumbar disc through 30 million cycles of multi-directional stress. That's the equivalent of 240 years of human life. We weren't just checking if the disc would break. We were collecting every milligram of wear fluid to analyze the footprint of the debris and comparing it to the FDA data for the industry leaders like ProDisc-L.
What were the results? Did the one-piece design actually change the wear profile?
The results were revolutionary. We saw a wear rate 3.4 times lower than the competition. But the real victory was the particle size. While others produced submicron dust, the AxioMed disc produced particles with a mean diameter of 1.9 micrometers. This is the sweet spot because they are larger, they don't trigger that aggressive inflammatory response. We effectively made the wear debris invisible to the body's inflammatory triggers.
Final question, Dr. Chin. What does this mean for the future of spine surgery?
It means we have to move from merely preserving motion to preserving biology. As surgeons, we want a 30-year-old patient to have a disc that lasts a lifetime. By eliminating mechanical friction and the resulting biological hostility, we aren't just doing a better surgery. We're setting a new standard for longevity. The data is clear. The future of the spine is viscoelastic.